Welcome to Season 2, Episode 2, Person First Language, the Power of Words and Recovery. This episode is extremely important because we're going to explore how language shapes the perceptions and experiences that people have in recovery, as well as focusing on the importance of person-first language and breaking the stigma and promoting dignity and discussions about substance use. All right, Dr. Farzad.
Yeah, so in today's episode, the power of words. I guess words can be powerful,
They
apparently. Maybe some people feel so. I mean, obviously, right? Obviously. But we do oftentimes forget that in the world of medicine and healthcare, to stick to those sort of principles, that the way we speak to people and the way we speak about people actually matters, right? Yeah, simple concept. So I'm hoping we can communicate some of that to our viewers, watchers.
Yes,
oh, yeah,
listeners.
Viewers, not watchers. Viewers and listeners.
Yes.
We have two guests with us today.
Yes.
I will let them introduce themselves. So Evonne and Fabiana, if you guys can, I'll have Evonne go first. Just, do you mind sharing a little bit about something or a little something about yourself?
Yes.
Okay. Here's my biography. No.
Queen.
My name is Evonne Hernandez, and I am the care manager for the EMPOWERED program. And I'm also now a certified alcohol and substance use counselor intern.
Woo, go Queen! I love it.
I'm excited to be back and excited to have this conversation. I think it's very important.
Yes.
My name is Fabiana. A little bit about me is, I guess I can say that I understand it from both sides of the fence, and I'm just grateful to be a part of this and a part of Empowered. So, yeah.
Yeah,
Yay.
wonderful. Thanks so much for sharing. Thank you both for being here. Amani, you want to jump into what our first topic of discussion is?
Ooh, all right. So understanding this person-first language, like, honestly, what is it? What does that mean? Honestly.
Really what it means is that we are putting the individual before the condition.
Exactly.
That's what it means.
I never heard about person first language until I had worked with a company called Best Buddies, which you partner people who have either an intellectual disability. So you would always name the disability first and then the person. And eliminating our word, all of that. I've never heard of person first until then. And then I didn't know there was a person first language in substance use disorder.
That there is. Yeah. Evonne, can you elaborate a little bit more about...
Yeah, so the language really is what we're encountering when we're not using that person-first language. Individuals are being called addicts or drogadictos, which would be in Spanish. And the correct phrasing is, someone struggling with substance use disorder.
Yes.
It's substance use disorder. It's not addict. It's not junkie. And so we're needing to change that. Also reducing that stigmatizing words, right, with providers, and because that not only impacts the person and how they feel, but also the choices they make, whether they want to seek care or not.
Yes.
And just the overall outcome of their health.
It does. The term I hear a lot is addicted babies. Like, just stab me in the heart. I hate that.
Oh, that's a big one.
No, it is. And you hear it, especially because of where we work at Empowered. We deal a lot with mothers who are suffering with substance use disorder and children who are born. And you hear that a lot. And I'm just like, gut-wrenching. It just breaks my heart.
And I've heard patients tell me that that's what they've heard in their professional setting, right? In the professional setting with their providers, and just repeating that same phrasing instead of changing it of what it really is.
Yeah.
No,
go ahead.
I was just going to say, even terms as far as like being clean is actually not person first language. I didn't know that either because I use it all the time.
It's not clean. It's someone in recovery.
Yes.
Right.
Or somebody who's abstained. Yes.
Yeah. So these are examples, right, of what basically you all have given some examples of words that maybe are not person first and can be super stigmatizing and negative in nature, and then some replacements. We'll get into that,
Yes.
right? But I want to hear from Fabiana, what is your experience when you hear, oh, we should be using person first language? What does that mean to you?
So, to be honest with you, this is my first time encountering this word. I've never even heard of it. I didn't know that now there seems to be a term for everything. So, so for me, I'm going to speak from the person in recovery perspective.
Please do.
Love it.
Because that's all I can speak from. And so, and I don't want to get emotional, but
Let it out, Queen, if you need to.
so I highly doubt that people live their lives wanting to be a drug addict or be a bad mom or not live up to their potentials. I don't think anybody shoots for that. But I think life sometimes comes, and if we're not mindful and if we don't understand the way we were raised, and know how to navigate through life, we're going to find things throughout our journey in life to help us get through things, because we don't know no better. But when someone has been through something traumatizing, or just something that has brought them to where they're at, to where you find yourself using drugs or alcohol, right? You're at a really low place in your life. To not feel that you are worthy enough to fight for yourself, you are at a very dark place. And so to kick somebody while they are still down or while they are down is inhumane.
And that's what these words do.
Yeah.
And when you...
Words hurt.
Yeah, because people don't understand the power of the brain, and not everybody's brain is the same.
Yep.
Okay? And we can live under the same roof with the same parents, but me and you may live two different lives.
Sure it is.
And I was just talking to Evonne about this in the room. So you don't know how things will affect people, you know? But I think if people are more mindful and not so quick to label,
Yes.
Right.
because it comes with judgment.
It does.
It comes with stereotype. It falls
Yes.
into racism.
Stigma.
It's just a lot of
Stigma,
things that come with it. But now, if you ask the same people and it's one of their children, would they still feel the same?
Yeah, would
No,
they still
you're
call
right.
them
Drug addicts. But I'm going to
Would
be
you-
honest.
right?
Would you still feel that much resentment towards wanting to just speak life, or just even just caring enough to understand what it means to educate yourself on the vocabulary of just to speak better?
And that's the
Correct.
key.
Yeah,
So,
That's the
education.
key.
Yeah.
Yeah.
You know, so I just educated myself here today on this word. Now I know to look out for it. And I just think it's really important, you know, and I think
And we
that's
could
the
educate
problem. Like,
others.
yeah, if people are not educated, they don't know. And I think that's a big thing today when people are just going by what they see on social media or what they hear through a word of mouth. No, do your own homework.
Yep. Get your own knowledge. That's what my
Absolutely.
uncle used to tell me.
Absolutely.
But you know, it's so funny how you had mentioned about if it was their own. I've run across a lot of people because I do love sharing my story because I'm just so blessed to have honestly made it out. And when I share my story, a lot of people will share about their daughter or son who has gone through an addiction. And I'm going to be honest, they're not using person first language either. And I don't know if it's because when it is somebody who's so close that it hurts so bad that you're just like angry, like it's a lot of anger behind those words, you know? I don't know, but
Or maybe it's that they're not comfortable, and it's almost
Yes.
embarrassing to have to tell your family, your friends that you're going through this, your child's struggling with this. And when you meet a stranger who, you know,
You're probably
you
not
will
going to
never
talk
see
to again.
You
I
know
want
what
to
I mean?
open
Let
up.
me
I
just-
want to talk to someone.
And they
No, you're right. But I think that also nobody really knows about this person first language. I didn't know about
that's
person
true.
first language until
right.
I started working at Empowered. And I took a class because when you start working there, you have to enroll in all of these courses. And I took a course and it was about person first language. And I was like, wow, I'm not even speaking person first over my own life. I call myself an addict. I say I'm clean. I say all this stuff like, you know, my daughter wasn't addicted to, well, no, ain't no kids addicted, you know, like just that
so
type
true.
of thing.
And that we no longer use substance abuse, right? It was substance use disorder.
Exactly.
Someone in recovery.
Exactly. And using the word abstinent, I didn't know about that, you know? And so that words are very powerful. I know in the Bible, over and over again, it speaks about the power of the tongue, you know, just how powerful the words are. And even they have all these self-help books on, you know, watching what you say, you manifest. So let's start speaking life over people. Let's start, you know, giving them a better outlook. I know if I'm already thinking of myself as an addict and then I go to my doctor and they're like, oh yeah, because you're an addict, this
I can't
is
prescribe
why.
you these pills
or whatever. Yeah, it just makes you feel less
Can
than
I say that
even.
I've even know women that have told me that they've been in the hospital and they're going through labor and they have their history, and because of their history, that these nurses, mind you, don't know you from a can of paint, but are coming in by what they've read on a clipboard, and now are being rude, kind of discarding your medical care,
Not prescribing certain things
you know
that
what I'm
you
saying?
may need.
Making you like not attending to you as if they were someone else who they didn't have to read that on. And because let's just say it just so happens that you come in and you do test positive, they are going to be judging you the whole time.
It's sad that we have to deal with that. And calling you an addict while you're at it, or saying you need to get clean, or saying you don't want your kid born an addict or addicted to this drug. I've heard it all, honestly.
When in reality, like, again, I highly doubt that people just are like, yeah, you know what, I don't care. Like, it's just not like that, guys. It's
People
something
care.
that drove, it's deeper than that, you know? And if we just cared enough to just be patient and just be kind and just take the time to meet people where they're at,
Yes.
there would be more, I feel like more success stories.
Yeah, correct.
Because it took Empowered for me to learn to love myself where I'm at today.
Amen.
It took them to love me first. So I learned to love myself without judgment, without criticism, without feeling like, oh my God, they're going to not help me. No, every time it was like, okay, it didn't work for you. Let's try something else.
Yep.
Well, because this is a medical condition. This is not you.
Right.
Like, this is not just what defines you.
Right.
Right? And so that's why it's so important for providers, even in documentation. I mean, there was a study, a Harvard study, done in 2010, repeated in 2013 and 2018, that discussed just how documentation was transcribed. And when you're using words like, substance abuser, right, or drug abuser versus a patient, struggling with substance use disorder, it determined how, like, whether they would receive care or they would be perceived as someone who should receive a punishment.
I mean, well, hearing
that it was a character flaw, or that that it's a moral flaw too, right? So, and it's not. It's
well,
not a character
honestly,
flaw. It's not a moral.
just hearing you say that, substance abuser and somebody who's suffered with struggling with the substance use disorder. First of all, it sounds like you're abusing it, like you just don't care. You're out there rock star life, Like it just sounds like, you just no cares in the world.
Correct.
Whereas somebody who's suffering, it sounds like, oh, hey, this person wants some help. This is something that they have no control over. It kind of sounds like the person is helpless in this sense, whereas the abuser sounds like the person has more control over the drug.
And mind you, everybody's different, so it's easier for some people to say, hey, why don't you just stop? It's like not a big deal.
Yeah,
Hey,
I've heard
but
that.
in all reality, everybody's addicted to something. Whether it's food, TV, sports, the gym, you name it, it's you're addicted. Okay,
I love, yes.
so
the way it's
but because
in your
it
mind.
doesn't fall under where because too much of anything you're gonna
Yes,
it's bad.
yes.
Okay,
Yeah.
but because you don't hear about it too often, it's not really out there. Does that make sense?
What's the medical? What's the data?
Oh
What's
my gosh.
the stats?
I
What's
don't
the
know. I'm about to
data?
fall- So for those that are watching or listening, I'm about to fall out of my chair like 14 different times just listening to this travesty unfold, right?
No, literally.
My gosh, where can I start? Okay, look, for those that are watching and listening, this is not scripted. Okay, Fabiana, when I asked you that question of what are your thoughts on person first language, and you said, hey, this is the first time I'm hearing about it. That was not scripted, but it was perfect because that's absolutely right.
That's what's happening.
Not a lot of folks know about person first language.
No, you're right.
We just talk the way that we talk. That's formed from our environment, our
Yes.
experiences,
Yes.
what we watch on TV, how our friends, the media, right? The media, addicted babies.
Yeah.
It's a tagline that catches attention. We can talk about that maybe at some point if we have time. But yes, so it's oftentimes good to just bring it up as a thing. And it's really not that complex. Person first language, going back to Evonne, what you had mentioned is you just put the person 1st and they are not their condition.
Amen.
So some real world applications. And again, this is sort of hinting at a little bit about this notion of parity where we treat physical health different than mental health and substance use, right? A lot of folks, let's say you have high blood pressure and diabetes. And if you go in medical documentation or the way your clinician is talking to you, they might call you a diabetic.
Right.
They might call you a hypertensive. But maybe they might also call you, oh, you're someone that has diabetes or you're someone that has high blood pressure. Now, the implications, I would argue, maybe aren't all that different when it comes to physical health. They still are different, right? Because we're talking about words matter regardless. But in the excuse me, in the world of mental health, they matter a lot.
Yes.
They matter a
Yeah,
lot,
they
right?
do.
So this notion of you're an addict versus, oh, you're someone that has a substance use disorder. Woo! That divide is huge.
It is.
And so our shortcomings in regards to mental health and substance use are way more impactful than our shortcomings might be in regular physical health. And when we talk about whatever, does this really matter? You hit the nail on the head, Evonne. Those studies, right? So that study, and it was a really simple study, right?
It was simple, yeah.
All they did was they said, we have someone who is a substance abuser, and we have someone who has a substance use disorder. And that was it.
And it
And
changed.
then they asked all the survey respondents questions. Do you think that this person would benefit from treatment? Do you think this person would benefit from da-da-da? Blah, 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 blah. And what they found was, Evonne, what you mentioned, that the person who they simply referred to as a substance abuser would benefit from punishment, didn't deserve treatment, should get better on their own, and should be able to just stop.
Wow.
So there is real world proof that
Wow.
simply a term such as substance use disorder versus substance abuser made a massive difference.
Based on what somebody else called you.
Based on
Correct.
what
Or said
somebody else
about
called
you.
this individual.
Correct, and
or
that's why
called
I
you.
say it's not just important that we're speaking in person first language, but as a provider, even documenting
Yes.
in that way.
Yes.
Yeah.
You're right.
Yeah. And to take it further, we're talking about documenting, but that also means the way that we discuss patients within our systems.
Within our
right?
so
Fabiana,
true.
you'd mentioned nurses when you go into a hospital. That includes the clinicians. It includes pharmacists. It includes the lactation consultants. It includes the charge nurse, someone who's coming in to take your food tray, to clean the bed. I mean, it is the whole system that sort of needs to be aware of and cognizant of this notion. Very simple. Person first language. So now you've heard, yes?
Yes.
You've heard. And we've talked a little bit about some evidence. Oh, I'll also just say, so that evidence supports that words matter, right?
Well, with piggybacking off what you're saying now, before we go any further, just to prove that words matter, they did a study on speaking into water.
Yes.
Okay. So this is just to show, and people, you can look it up yourselves on YouTube. Feel free, do your own homework, like I said. But look it up. So you got these individuals who speak positive, uplifting affirmations into the water, guys. And they turned out to be these beautiful little snowflake crystals. They all are individually unique. Now, they have a study that shows you speaking negative, degrading, just bad words, right, into the water. And it turns into this dark, ugly color.
And the molecules.
And then plants as well. If you speak to plants and you say good things to your plant
Will thrive.
Absolutely. And if you don't, then it will die. Like I said, do your own homework. So that just proves, again, the power in words. If you need any, I don't know how you can make it any more clear.
I love that water example because I've seen that too when I was looking up into how words are so powerful when I was into manifesting and everything. And sure enough, I saw that water thing and she was right. The water molecules were just they look wretched. It was awful. And it's like, can you imagine? I was just thinking we're putting this in our body, but it just goes to show how our words,
our brain.
even, yes.
And our brain has a part of it that starts recording, the membrane, like where it'll start recording. So after hearing something for so long, you kind of like, it stays programmed in your brain. And then how ill is that? So for me, what started off as a survival but happened so often became a lifestyle, became a habit that eventually became a lifestyle.
Then became who you are.
Yeah, and by the time I realized it, the snowball had been going on that you can't just stop something like that. And it takes care, and it takes people who care.
It does. It really does. People who are going to love you when you're not loving yourself at the moment.
And understand that everybody's different. Like literally everybody's different. And when you speak hope into people, just that much, like, guys, whether people believe it or not, it just makes that much of a difference.
It makes a difference.
Like,
I've had patients tell me, or participants of the program tell me that, it's like, well, I've been told that I was just a drug addict, so I guess that's who I am. So I continue to use.
My mom's a drug addict, my dad, me. Yeah.
I guess that's who I am. That's my way to define. Now, and then it's difficult to reframe that because I think we all may have done that at some point or do that still at some point. I know I do, where I say, well, if that's who you think I am, I guess I am. But why can't we change that to say, no, I'm going to prove that that's wrong. I'm going to prove you wrong. I'm going to change that. It's not what you say I am. It's who I am. Really, who I know I am, who I define myself. But someone who is in this vulnerable place or, shut down, tear down,
the mental health,
have mental health issues and that need to be addressed. Like, we're going to lean on the negative, on those negative words. We're going to,
because that's all you know.
That's all. Yep.
Because that's all I know. That's what I've been told. And so, when you're vulnerable, that's where we're going to go negative.
And that's what you embrace.
And if there's comfort there, if that's all you've ever known, and it's not cool, but it's comfortable. It's a comfortable feeling. It's familiar.
Right.
So I'm going to stay here. That doesn't allow that individual to even feel like they have that potential. But if you have somebody who's outside, even like, for example, myself, I was coming in Empower just for these groups. It was those groups that they would speak life back into me, and I'd carry that with me, and then it would bring me back, and I'd take a little bit more that day. And you know what I mean? Because after being reminded or told that for so long, you believe it. You really do. And then when life comes and you've made bad choices and you look at your life and you're like, maybe I was, but wait. No, you have to literally remind, that's who you were. You did the best you could at when you could. And therefore, that should not stop you from thriving.
Recovery, your journey.
Because there's more. Like, there's just no way that this is all we were meant for.
And
You
here's
get
the
what I'm
thing:
saying?
when we're told
Yep.
that, or you're told that someone who is struggling with substance use, then they'll start using isolate, right?
Yes.
In isolation with no one there. So yes, it will. The risk of overdose will increase.
Yeah. So so this is this is how I want to summarize words, because of what you all have been talking about. But your most recent point, the positive words, these person first language types of words, through and through. Let's call it heal. The negative ones, harm.
Yeah.
Or
Yep.
the opposite ones,
Right.
harm.
Love it.
How does it harm? Well, you're using isolation. Now you overdose. No one's around to administer Narcan, give you CPR, call the authorities. You're dead, right?
Yeah, right.
So it physically harms.
It
Now there's
does.
different ways that it can harm. It can keep people from not engaging with treatment.
Yes.
It can sidetrack their treatment.
Yes.
Well, maybe now today I'm not going to take my medication because I'm just an addict. I mean, there's so many
Yeah.
implications.
Or when they relapse, because people will. Sometimes it happens throughout your journey, right? If you relapse, doesn't mean you have to stay there. It means you made a mistake
And
that's
bounce
it.
back.
Yes.
It's time to bounce back.
Use your tools.
Yeah. Okay. So you're mentioning some terms, and I'm going to try to remember those. But I want to start with okay. Let's go Amani, and then I want to hear from you, Fabiana. Words that have been negative, not person first. What sticks out to you, and what would you have folks use instead? So, like I've heard, for example, you say addict.
Yes.
Like no one should be
That's
called an
my-
addict. Okay. What
that's
should
my
be
tr-
if that was very impactful to you? Then that is what would you prefer to be called? Or you know, X, Y, and Z was language that was said to me, and it was a no go. Here's what I wish people would use instead. Anything along those lines.
All right. So the word addict for sure is a trigger word. I don't know if you can see, but my eyes twitching at this point because it's mm-mm. So I would rather somebody just acknowledge that I went through a substance use disorder because that's what it is. It's not something I chose. It's not something that I wanted to. When I think of an addict, I think of somebody who's just like, oh, this is what I'm going to do with my life. You know, that stigma I have in my head, that's what I think of, and that's what I'm not. And I used to hear that a lot. And people, you know, you're an addict. You know, if you don't stop, you might as well start chewing. Somebody told me if I don't stop using that, I might as well start me a new family because there was no way I was getting my son back. And I might as well just start fresh there. And instead of me saying I'm going to prove them wrong, I was like, you know what? I need to prove me right because I know that I can do this. And luckily, I did have that little bit of hope inside of me. But I ran across a lot of people in my addiction who did not have that little bit of hope inside of them. So imagine hearing that and being, well, hey, that's what I am. Because that was me before at one point. And then the Lord had to work within me and to where I'm like, no, I'm going to prove myself right. But that's because somebody had spoke words of life inside of me that I held on to. It was a seed that was planted.
Okay, Fabiana, what are some of those words that you've heard that were actually super harmful, and what would you hope that people would say instead?
Wow.
Yeah. I mean, see, here's the thing. Like these words that you hear, like she said, they will stay, right? And then you're just repeating it to
In your
yourself,
head.
right?
It's almost like you're not worth it.
Right. Or like you're not enough.
Just kill yourself. You want to die? There's people out here trying to live, and you're over here killing yourself. Just kill yourself already. You're a hoe who just sells herself for drugs. You're a junkie.
Junkie is the worst.
You're a crackhead, I'm sure. You dope fiend.
Well, I've heard those.
You worthless piece of shit.
Yeah.
And I wish they would have replaced it with, you're going to be okay.
Amen.
You're trying.
It may not look like that right now, but you're going to make it. I know it looks dark, but there's light on the other side, and I'm here just to help you. I'm not here to judge you. I'm not here to put you down. I'm not even here to remind you of the shit that you've already done, because you're good at doing that yourself.
Right.
That part.
Yeah.
They already know.
That part.
Yeah.
They know it's a struggle.
Yeah, Evonne, can you tell us, in your experience, what words are people being told that are negative, harmful, and what words you try to use. What words do you want the medical community, folks out there that are friends, family members of those that are using substances? How do we shift sort of that language?
I think just being intentional with your words, right?
Yes.
Being mindful of your words. And I keep hearing addict, right? And in Spanish, like I said earlier, it's drogadicto, right? Which is just drug addict, right? That's just a drug addict. Even just the word just, right?
Right.
It's like that's all they ever are. So changing that, to be like, no, that's just someone struggling with substance use disorder, just like someone who is struggling with diabetes, right?
Blood pressure.
And she spoke about relapse and how that's something
Part of
that recovery journey, and it's the same for someone who is struggling with diabetes, right? It's we sometimes we'll have a piece of cake when we're not supposed to, or and so shifting that mindset would be more of what I see the need for. And then changing that mindset does mean that you're going to change your language. How do you view people?
I forgot to mention one. I really didn't want to mention it, but I feel like it's being tugged at my heart. And I think this is one that strikes me the most, and that I didn't love my kids enough.
Yes.
And that one strikes me because it was never a lack of love for my kids. It was always a lack of love for me, for myself. So for someone to tell me that if I loved my kids, I would just stop,
Right.
is kind of like, ouch. Because then you want to believe that, because I believe a mother's love should conquer
Override
everything. And unfortunately, because of our mental health not being addressed right, because everybody just not being aware
Or dismissive.
and dismissive about people's mental health and allowing people to be honest so that we're able to help them where they're at and not criticize them.
Yeah.
What do you?
I hear a lot like, well, they chose that.
Yeah.
Well, that's what they want to do. Because they could
Like
just
anybody
stop.
can stop. Go to a program. Go
Go
get
to-
help.
go to a
You're not
program,
doing
go get
nothing
help.
better.
I'm gonna be
yourself.
honest. Before my addiction, that was me. I'm not even gonna lie. Be like, really? You're gonna choose a drug over your kids? Until I had to go through an addiction, and it is not you choosing a drug over. First of all, it happens so damn quick that you're like, what happened? Why is my baby not here? Okay, it's time to really slow down. Let's get some help and everything. I mean, it just happens so quick.
Yeah, it just takes over.
Yeah.
It takes over.
One thing I would love to say, though, if anybody, and everybody who hears this and can hear my voice right now, if you could really just stop using the word addict and replace it with substance use disorder, that is the first step to making other people just feel a lot more comfortable. If we could just stop using addict and replace it with substance use disorder, someone who's struggling with substance use disorder, that would be the first step to
Or
greatness.
just, not substance abuser.
Because
Substance
because it's
use
rooted.
disorder.
That's just, I feel like substance abuse is a solution to people's problems. That's not the problem. We need to find the root of the problem, which is mental health I think more importantly. And it goes for even men out there, because there's a stigma with even men admitting they have mental health issues and not being able to address their mental health issues because they have to be macho or they can't look weak. But that's not weak. Mental health, if you're not mentally okay, you're not going to be mentally anything else. So.
You're right.
Yeah, a lot, right? A lot. Amani, you had mentioned addict, if we can sort of get rid of the word addict. I'm going to go through just like a handful. What I would urge listeners and viewers to do is just go Google. Sorry.
Yes.
Not to use Google. But specifically, just go search.
Yes.
Okay. Just go search person first language. Person first language space substance use.
Yes.
And you'll see there is a very generic list of the top terms that folks use that we're looking to change. And I'll go through some. Addict is probably maybe number one.
Number one.
Yeah, number one. And replacing that with someone that has a substance use disorder or struggling with substances. Right?
Struggling with substances.
I mean, you can,
Love it.
there's
Short and
a
sweet.
lot of replacements, right, for each of these. Nothing is set in stone. Clean. when you just think of the term clean, what does the opposite imply?
Dirty.
Dirty. So you're dirty because you use, I mean, it's so negative, right? And so we don't use that term, whether we're talking about someone who's using substances or whether we're talking about where else is it commonly used in discussing the results of a urine drug test.
Correct.
People will say, oh, it was a clean test. Oh, it was a dirty test. Yeah. Horrible.
Yeah.
Okay. Very simple. We try to medicalize everything. Like, oh, the test was positive for opioids. The test was positive for methamphetamine. Like, that's how I talk about it. Not, it was dirty. Just take these terms and
That's
multiply
very
them
common.
out,
It's like,
right?
did it not take a shower?
They're homeless, right? So they're homeless. No, it's someone who's experiencing homelessness or housing insecurity. Again, there's lots of variations of terms that we can use.
Or displaced.
Displaced, yeah. One that's also falling out of favor. But I will say this because it was so commonly used is relapse.
Yes.
Right? Relapse. We don't ever use it for high blood pressure or diabetes. How many times will someone go to the doctor, right? And it's been 3 months. You've been on medication. You're trying to make nutritional changes, activity changes, and maybe your sugars went up a little bit. Maybe they came down, whatever, right? But if they went up, who in that clinic is saying,
Well,
You
relapsed
relapsed on a Twinkie.
you experienced a relapse, and now you should be punished. You should be kicked out of clinic. You don't deserve treatment.
I should refer you.
I should refer you. You should get better on your own. I mean, I have
We'll
personally
wait till you're
never
ready.
experienced this with other medical conditions, but we say it all the time for addiction. For addiction.
So what would be the opposite?
Yeah. So a term that is falling into favor is just return to use.
Okay, like that.
Keep it simple, guys. Keep it simple.
Keep it simple,
All
silly.
those
They return to
terminology.
use.
I love
Yeah,
it.
yeah, but there. Look, like I said, just search it out because we can go through a whole list of,
Right.
of words that are falling out of favor. We call them don'ts. You might see them in red. You might see it says avoid, and then green. Here's what we're using.
Yeah.
Here's what you should
And
say.
it's a couple of more words, but it makes a lot
It
of
makes a
difference.
big
It makes a,
difference.
it makes a
Big
huge
difference.
difference.
And just that couple of seconds that you take to use those few more words is going to change someone's whole entire life.
The whole journey.
And
the
not only
whole
that, but I
path.
think
That
people, I'll
part.
speak for myself. Like for me, I'm a person who I feed off the energy. So if I could speak life into somebody, it makes me feel good about my
Right.
day and that I did something. It was nothing big. I may have even just held a door for somebody, but I did something for somebody. And it made me feel good to be able to do something for somebody else. And I think if people realize that this journey in life, it's not about us. It's about our journey to where we're going and the people along the way that we're able to help.
Yep.
Right.
yeah, I really like that.
I
love it
Let's
too.
put a little
It's-
trademark on
your
that,
friend.
Fabiana. Okay. All right. Yeah. So can we go back to the whole addicted baby
Of
thing?
course.
Addicted baby. Impossible. It's impossible to have a baby that's addicted to anything on this planet because it doesn't meet the criteria for an addiction. right?
Correct.
A baby cannot possibly meet the criteria for an addiction. Okay.
That is so funny.
Technically speaking, if you look at the criteria for a substance use disorder, addiction, let's call it, there's 11 diagnostic criteria, and it has to do with things like time spent surrounding
Yep.
use, you're taking longer, you're using longer than you intended, you're using more than you intended, you have physical problems, you have social problems, the list goes on and on and on.
Is your life disintegrating,
Yeah.
kind of?
Withdrawal
And last
symptoms.
time I checked,
Babies.
a baby is not born and then is like, can I get? No, that doesn't happen.
Yeah.
So what we should be using is just physical dependence.
Physical
They were in
dependence.
utero, they were exposed to opioids. When they are born, that exposure is cut off. So they're just in withdrawal because they have a physical dependence. And we deal with that. They are not an addicted baby.
They were a
I have
baby
s-
exposed.
Yes, and now they have this physical dependence, which exhibits itself as withdrawal.
Yeah.
Okay,
Got
but it's
you.
not an addicted baby. That is definitely one of my pet peeves when I see it in the
Yes.
media.
Because some
Like,
people don't want to adopt babies who are addicted. So
Addicted.
they'll make that. Is that baby an addictive baby?
Mm-hmm.
Oh, I don't want no addictive babies.
Was the parents an addict?
So you make a
Back to
good.
that.
That's a really good point, doctor. That No baby is addicted, guys.
It's just it's impossible. So let's stop
Thank
using that term.
Yeah.
Let's
They were
stop
just
using that term.
exposed in utero.
Which is big
Dr.
difference.
Farzad, is there a difference between dependency and like a substance use disorder, I guess?
Yeah, absolutely.
Okay.
So physical dependence, what does that mean? It means that if I remove that substance from your system or I decrease, you are going to experience a withdrawal syndrome. Okay? Yeah, that can happen with all of our substances, right? You name it. Alcohol, tobacco, nicotine, let's call it. Alcohol,
Caffeine.
nicotine,
You're right.
Caffeine,
Yes.
opioids, methamphetamine. If you were to withdraw those substances or decrease them, you would experience something, okay? And that's what that neonate is experiencing. But that term, how we describe that, is physical dependence, right? It's called dependence. That is one of 11 diagnostic criteria for a substance use disorder. Well, to have a substance use disorder, you need numerous of the criteria,
Right,
not
6
just
or
one.
more.
And that's why it's technically impossible for a baby to be addicted or have a substance use disorder because they don't have any of the other criteria.
Love
Right.
it.
There you go.
Thank you for educating us.
Yeah, education is key.
It
I actually
is.
had
Knowledge
a
is power.
patient that delivered, and she felt like she was not treated
Fairly.
fairly, but and stigmatized. But what she mentioned was she was talking to, I believe it was her CPS caseworker, but she stated that she's like, well, I actually have a dependency. Like I sought the education, and I was told I'm dependent, and so I do need treatment, I do need care, but dependent. She's like, oh no, what you are is a functioning addict.
I've heard that so many times.
I was like,
too.
excuse me.
A functioning addict.
And here is someone
I've
who
heard
is,
that.
who just learned, the proper, terms and using person first language,
To
right?
advocate for yourself.
Advocating for herself. And being
then
told,
somebody knock it
well,
down.
see what it's
Clobber.
called, or what how we talk about it, right?
Wow.
You're a functioning addict. It's like, how does that make her feel?
So is that a
heard
compliment
that
or
part,
is that a
like I'm functioning? Like, what is that supposed to
Or is
mean?
that, yeah, do I take offense to that or like what? Because I feel like she was
So
trying
do I
to.
still seek treatment?
Yeah,
Yes, like
because I'm
she's asking
functioning.
for
Because I'm
help,
functioning.
and you're telling her that she's okay,
Yeah.
that
Yeah.
she's able to function.
Yeah, I mean, so clearly another situation where words matter. They
Yeah.
can confuse, they can harm, or they can heal. Wrapping up, Fabiana, I want to hear from you. Give us your one-liner to everyone who's listening, watching, to the medical community. What's the one message that you would have us all sort of take away from all this?
I think I already said it. I think if people just stop being selfish and thinking about themselves and how they benefit off of it, and actually just realize that this journey, this path that we're on, it's about others. It's about helping others. It's about loving others, and just being mindful. Just being mindful. There's a lot of hate in the world. We don't need any more.
Nah.
Yeah.
Evonne.
I would say be intentional with your words.
Yes.
For providers, depending on how you interact and communicate with your patient, that could either bring them closer to care, bring them closer to recovery, have that impact, a positive one, versus pushing them away or tearing them down. And for them, wanting to seek something else, or not seeking care at all. Like I've had patients come and say, I don't want to go back to my OBGYN, and that could be, because of an experience or something they felt in that moment, or they can just say, well, I'm just embarrassed that I'm using. So imagine, you're here 4 months in your pregnancy and have not received any prenatal care. And, I see that a lot. So changing that for, providers being intentional, mindful, and for those who are in recovery or struggling with a substance use, to not isolate.
Yes.
If your family is not a positive or a safe place to open up with, I know a lot of patients will hide their use from their family, especially if they grew up in a home where maybe that wasn't something that we would talk about, or that was in our face, right? So we won't talk about it, we'll hide. And if we cannot open up to our families, like there are people you can open up to, and who there is help, who want to walk with you in this journey, help you find easier ways to get through it, build your little toolbox.
Yes.
And that could be peer support groups here at Empowered. If you're, a mom struggling with a history of or a current use of opiates or stimulants. And yeah, look into your community if your family is not there, but do not isolate. Do not, you shouldn't have to go through this alone. No matter, you're worth it, and your care is important.
That is so true.
What about you?
So much. But I would have to just basically go back to, especially with practitioners, medical practitioners and whatnot, because I would have to say that's kind of like the first step in recovery, or the first opportunity that some people may have in recovery, but it's just to meet people where they're at, honestly. Love on them till they're ready to love on themselves. But honestly, if that's too much, because sometimes it might be too much for certain people, if you could just start by at least just changing how you see the person, even if you just not use the word addict anymore, I'm just going to go back to that. Sure. And even now, knowing that since babies cannot possibly be addicts, please do not call these children addicts as well, but just substituting that word for the plethora of words that are there that you could use
instead.
Yes.
Let's not contribute to the biases.
Yes.
And I'll close with, we've clearly demonstrated that words matter. They can heal, they can harm.
Yes.
But I want to, for all those that are listening and watching, and particularly the folks in the medical community or healthcare system, please, like Evonne mentioned, please be intentional with your words. Just think about maybe how you might want to be spoken to.
Or your children.
Yeah, or your children. Why? Because it's so impactful. We are dealing with a world where the next time someone uses a substance, they can die. It's not like a joke.
It's not.
It's not that
it's not a game.
Maybe in 20 years. No.
They might not even have.
Tonight, this afternoon, they might die. So if we in some way indirectly maybe contributed to that because of the word that we used, which was addict instead of substance use, right? Substance use disorder. And that person said, I feel like this, this, and this, and tonight I'm going to use, and then I'm dead. We had, that is a huge, right? A huge fail.
It is.
So just please understand that we're dealing with something that is life or death on a second-to-second basis. Let's try to use positive person first.
And you're
That's
dealing
part
with
of the prevention.
people. Please not forget, you're dealing with people.
Yeah, today it's them. Tomorrow it could be you. It could be your kids. It could be your grandkids.
Yeah, absolutely.
It don't matter.
Yeah. Y'all, thanks so much.
Thank you.
Thank you, Evonne.
Thank
Thank
you
you,
for having me.
Fabiana. Thanks
you
for
so
joining
much.
us and the Empowered Voices and for your contributions to this hopefully super valuable discussion.
Yes, absolutely.
Thank you, everybody, for listening or watching to this premiere episode of Empowered Voices. Be sure to subscribe wherever you get your podcasts, as another episode drops in 2 weeks. Also, don't forget to rate and share with others who may find our information and discussion topics helpful. Thank you all. If you live in Southern Nevada or in Reno, Carson City, Churchill County, or Lyon County in Northern Nevada, or Weber County in Utah, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance is required. Visit empoweredmoms.org for information or to request services. If you live outside these areas, we encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andrew Peterson and Jason Roth, with production assistance by Rachel Mack. Recorded at the Video Podcast Studio in Las Vegas, Nevada. For more information about this podcast and past and future episodes, visit empoweredmoms.org.